Hey everyone, my name's Tracy, health coach and personal trainer and founder at highenergygirl.com, where we help women over 50 age stronger and healthier. And today I'm going to teach you something I just found out, but it is a viral, a certain virus protection strategy. Okay, so I was listening to Joe Rogan with Dr. Peter McCullough, and let's hear what he has to say.
It's not a hand infection. This focus on hand sanitizers, like we're all getting infected hands.
It was pretty early on, though,
It's not
wasn't it?
even, no. You still go on DFW Airport, there's hand sanitizers every 6 feet. There was pictures of people spraying football stadiums with sanitizer. It's not spread on football seats.
Okay, so when it first hit, I went out and stocked up on hand sanitizer, which I have never, ever been a fan of. I think that we as a population are too clean, and that is not how we build a strong immune system. So let's finish and see what he says is a better option.
It's not Ebola. It's not Clostridium difficile. It's spread in the air. But if we would have focused on contagion control, that was reasonable. That would have been terrific. The most effective contagion control, by the way, is 2021 data, is actually using oral nasal virucidal therapy. Far and away.
Yeah, explain that, please.
Yeah, oral nasal virucidal therapy is basically using, virtually anything kills the virus. Any disinfectant kills the virus. Iodine kills it on contact. So if we use dilute betadine, and so if you take a betadine over the counter, it's a brown bottle. We use it to sterilize wounds in the ER. Buy it at any pharmacy and take 2 teaspoons and 6 ounces of water. Take a nasal spray or a syringe brim, a syringe bulb, and spray it up your nose. Snort it back to the point, so back of your throat, and spit it out. I'm sorry that's gross for your audience, but you got to get it up there and back. That adequately decontaminates the nose. Then gargle with the rest of it. Finish up with some scope or Listerine. Doing that after you return from a day out with contact with people, especially close contact in close rooms. I'm talking public restrooms, small conference rooms. You have to be in contact with somebody for about 3 hours, honestly, in a small room with no airflow to get it. Or go into a loaded room like a public restroom or tight places at small stores. The bottom line, that's where people get it from. Once it gets home, 85% of it spreads in the house. But using oral nasal virucidal therapy is such a huge advance that in a randomized trial by Chowdhury and colleagues from Bangladesh, 303 patients randomized to this virucidal therapy, which is all topical, no prescription drugs, nothing else needed, versus a control group, which was just warm water. 303 patients in each group. It dramatically reduced the PCR positivity by day 3. It knocked it down from 303 down to 24 patients still positive. Those who got the control, they're still all positive. And it markedly reduced by easily 75% chances of having progressive disease, ending up the hospital or death. And it's enormously preventive. And now we learned we can use hydrogen peroxide, dilute hydrogen peroxide with some Lugol's iodine. And believe it or not, the dentists in the American Dental Association guidelines use for cytomegalovirus and Epstein-Barr virus, gingivitis, they use sodium hypochlorite. That's actually dilute bleach. Turns out it just takes a few drops of bleach in some household water. That's for the mouth. We typically don't use it in the nose, around the eyes.
Okay, so let's go and see what it's like with hydrogen peroxide. I do not have any betadine, and I thought I would just try out the hydrogen peroxide solution that I found on Dr. McCullough's Telegram page. Okay, so let's try this out. Now you want to dilute the hydrogen peroxide 1 to 3. Okay, so that's 1 ounce of hydrogen peroxide to 3 ounces of water. So here is a glass container with 3 ounces of water, and we're going to add 1 ounce of hydrogen peroxide. Okay, that's our dilution. Now I recommend getting one of these saline rinse bottles. You can get them at any of your local drugstores. This actually comes as a bottle with a bunch of saline packets, which is great for allergy season, let's face it. So then what we're gonna do is pour the solution into the bottle. And now we have the fun part, okay? So what we're gonna do is we're gonna inhale so that it comes out. You wanna get it all the way up. It doesn't feel very good, so pardon my expression because I'm probably gonna look pretty funny. said it works better than hand sanitizer because it cleanses your entire nail passage and your throat. And then he says to finish what's left in the bottle, which I will not do on camera. Okay, that was pretty brutal. I have to admit, even for me. And I think I'm going to try the betadine solution next time, and I will report back and let you know if it burns quite as bad. So please note, he did say 3 hours of exposure or a tight place such as a public restroom. So I hope you'll try this solution when you are in a germ-infested area and you want to just have a little bit of prevention. Also, please check out the video that I did on ivermectin, and I'll put a link for that below. All right, you guys, I hope you stay safe out there. Just boost your immune system, do all the right things so that you can help your body fight all disease. All right, you guys, if you haven't already, please like, share, and subscribe, and I will see you next week. Bye for now.